Viagra treats erectile dysfunctions, but what if I told you that we can fix erectile dysfunction? There's many forms of regenerative medicine out there now: PRP, Botox, Shockwave Therapy, and all these are changing the way we treat erectile dysfunction. I'm Dr. Justin Houman, board-certified urologist and men's health specialist, and I see 30 guys on a daily basis with severe erectile dysfunction. They all ask me, how can they fix it? There's no doubt that we need better options for fixing erectile dysfunction. We all know about Viagra and Cialis and what these do for erections. They increase blood flow either for 24 hours or for a couple hours, all of which help us with our erectile dysfunction. However, a lot of guys, younger guys, are experiencing erectile dysfunction in their 20s and 30s, and they're looking for other answers. So when you think about erectile dysfunction, whether it's a vascular issue, hormonal issue, nerve issue, even a fibrosis issue, it all comes down to one thing: a circulation issue. We want to increase the amount of blood flow into the penis, and that can help address erectile dysfunction. There's now these new long-term solutions for erectile dysfunction that could help reverse the aging of the penis, if you will, and increase the amount of blood flow, not just for the course of a pill, but for long periods of time that could help you sustain longer lasting erections for a longer period of time. But before we do that, click the subscribe and like button below so we can talk about this topic and many more men's health topics. And at the end of this video, I'll give you my favorite options amongst the three. What if I told you that we can increase the amount of blood vessels within your penis, giving you a longer lasting, stronger erection? That's called low intensity shockwave therapy. Think of it like physical therapy for the penis. We use sound waves, acoustic waves, to create microtrauma within the erectile bodies of the penis. And what that does is it leads to something called angiogenesis, or new blood vessel growth within the erectile bodies. So you get new blood vessels, it really brings more blood into the penis, giving you a stronger, longer lasting erection. As a result of this is something that's a long-term solution for erectile dysfunction. We have great data supporting this. We looked at men who used it. About 64% of guys objectively, based on surveys, had longer, stronger erections using this. And the treatment really comes down to, it's about 6 treatments over 6 weeks or 6 treatments over 3 weeks. And some guys like to do maintenance doses on a quarterly basis, once every 3 months. It really does work well. The one thing I'll tell you is you always want to use a focused machine. You don't want to use a radio machine, a focused sound wave machine. Make sure whoever you're going to, you're asking them if they're using a focused machine. And some guys ask, am I supposed to come in with a boner? Am I supposed to come in with an erection? The answer is no. You just come in. It takes about 13 to 15 minutes to do this. The acoustic waves stimulate a little bit of microtrauma in the penis, creating new blood vessel growth. It really helps in terms of regenerating some of the tissue within the penis and giving you stronger erections. This next one, we inject your own body's growth factors into your penis to create longer, stronger erections. It's called PRP, or platelet-rich plasma injections. So the way it works is we draw about 60 milliliters of your blood and we spin it down. When you spin it down, there's this component of the blood called the platelet-rich plasma. It looks like liquid gold is what we like to call it. And what we do is we extract that component after spinning it down for about 30 minutes. We take that component of it and we inject it into the erectile bodies of the penis. And what it does is it helps reverse the age of the penis. So what I mean by that is, as men age, our penises become more fibrotic, or at least the smooth muscles that are involved in getting stronger erections, that smooth muscle becomes more fibrotic and a little bit more stiff. And what this does is it helps reverse some of that. It reduces the inflammation, it reduces the rigidity, and it regenerates some of that tissue so it gets its elasticity back. And in doing so, it gets some more stretch to it and more blood. When it comes in, it's able to hold more of that blood, ultimately resulting in longer lasting and stronger erections. So that's what platelet-rich plasma does. It's a series of 2 injections separated by about 4 to 6 weeks, and the data really supports this. We've done studies on men who objectively, based on the 2 injections before and after, they're able to tell us that their erections have actually significantly improved. They feel like they have longer, stronger lasting erections, and ultimately this is, again, a good solution, a good long-term solution for erectile dysfunction. Botox isn't just for your wrinkles anymore. It's for your erections and for your penis. We now know that by injecting Botox into the penis itself, into the erectile bodies, it does help support stronger, longer lasting erections. And it's a good long-term solution for guys who are experiencing erectile dysfunction who don't want to be on the medications of Viagra and Cialis. So how does it work? When you inject Botox into the penis itself, the smooth muscles within the penis are relaxed. And when you have more relaxation of those smooth muscles, it brings more blood into the penis. And More blood means stronger erections. So we have good data supporting injecting Botox in the penis anywhere from every 3 to 4 months can help relax that smooth muscle, and objectively, based on our ultrasound findings, there's objective data to support increased amount of blood flow coming into the penis as a result of the Botox injections. There's some men who actually really love this, and they come in every 3 to 4 months for an injection because either they no longer have to take the Viagras and the Cialis, or if they are on those medications, they're taking a lot less of those medications because it's really helping support increased amount of blood flow coming into the penis. So it's a great solution for guys, absolutely. It's a good long-term solution for addressing erectile dysfunction, especially if you want to avoid the Viagra and the Cialis pills that some guys take on a regular basis. So guys ask, how does this look, or which one of these should they choose? So if I had to rank them myself, I would probably say Shockwave Therapy is the best version of this, the best long-term solution to erectile dysfunction, especially if you want to avoid being on Cialis or Viagra, or if you're on those pills now, you want to avoid them and not take them anymore. It's really, really great. Make sure you're using a focused machine. That's what I would recommend the most. Next up, I'd choose PRP. A lot of times you could do PRP with the Shockwave. It's a combination that a lot of guys like to choose. While they're getting the Shockwave therapy, within separated by 4 weeks, they'll do the PRP. That's a great option for, again, preserving their long-term erectile function, acting prophylactically in order to avoid erectile dysfunction, or even trying to decrease the amount of medications you're on. And then finally, at the bottom is Botox, where it's a great option for a lot of guys, a lot of older guys like this. This is more for guys who are taking Viagras and Cialis. They're probably maxed out on those pills. They want to take less of those medications, so they take Botox, and it either cuts their dose by about 50% or sometimes even 75%. So that's a great option too. But if you really want to act ahead, if you're a young guy trying to preserve your erectile function at a young age, I'd start with Shockwave Therapy and then PRP. But remember, the lifestyle components are the most important thing here too, right? You got to get some good sleep, good restful sleep. That's good for your hormonal health. Eating, a combination of lean proteins, healthy fats, complex carbohydrates, minimize your stress as much as possible. And lastly, exercise, heavy weightlifting 3 times a week, cardio at least once or twice a week. Those are the mainstays for healthy living, healthy erectile function, and healthy overall health.